Every year, the med students lose marks in one bone, that is the clavicle. However, that should not happen anymore. Let me break the anatomy of the clavicle today. Now, the clavicle is a long bone with a slight S-shaped curve. Most of the people know it as a S-shaped bone. It is located horizontally on the anterior aspect of the body at the junction of the root of the neck and the trunk. This bone is usually found. It is anatomically located in the anterior aspect of the body, that is the front part of the body, at the junction of the root of the neck and the trunk, and it articulates medially with the sternum. The sternum is the breastbone and the first rib cartilage, and laterally with the acromion process of the scapula. It is subcutaneous and hence it can be palpated through its entire extent. So if we talk of it being subcutaneous, it means that it is located superficially and it is the only bone that is attached to the trunk. It is the only bony attachment between the trunk and the upper limb. So this is the only bone that attaches the trunk. The trunk basically consists of the thorax and the abdomen. So it attaches the trunk with the upper limb. So here is a diagrammatic representation of the clavicle. So here we have the S-shaped bone, and it is a long bone lying horizontally. So here is the acromial head and here is the sternal end. Then this is the shaft or the body of the clavicle. Then here we also have the trapezoid ridge. This is where the trapezius muscles attach. Then we have the conoid tubercle. We have the subclavian groove. This is a groove for the subclavius muscle. It is a groove where the subclavius muscle attaches. Then we have a rough impression here for the costoclavicular ligament, and then we have the sternal end. This is the part that attaches to the sternum, which is the breastbone. Then the acromial end attaches to the acromion process. Then functions of the clavicle: it acts as a strut for holding the upper limb far from the trunk so that it can move freely. So what this means is that the clavicle helps in the natural swinging movements of the hand, which helps in things like grasping and hand swinging during walking. Then transmit forces from the upper limb to the axial skeleton, that is the sternum. So the axial skeleton basically involves the skeleton within the trunk, that is the thorax and the abdomen. So it transmits forces from the upper limb to the axial skeleton. Then it provides an area for the attachment of muscles. So several muscles attach to this bone, as we will see later. Then we have some of the peculiar features of the clavicle. What are the features that makes the clavicle unique? Number one, it is the only long bone which lies horizontally. This is in contrast with the other long bones like the humerus, the femur, the tibia, the fibula. It is the only long bone that lies horizontally. Then it has no medullary cavity. It is subcutaneous throughout its extent, which means that it can be palpated superficially. Then it is the first bone to start ossifying between the 5th and 6th week of the intrauterine life, and the last bone to complete its ossification at around 25 years. So it is the first bone to start ossification between the 5th and the 6th week, and also the last bone to complete its ossification. Then number 5 peculiar feature is that it is the only long bone which ossifies by two primary centers. As we will see the ossification centers later, then it is the only long bone which ossifies in membrane except for its medial end, uh, as compared to the long bones that ossify in the cartilage. So majority of the long bones ossify within the cartilage. However, the clavicle ossifies in the membrane. Then it may be pierced through and through by the cutaneous nerve, that is intermediate supraclavicular nerve. So these are the peculiar features which makes the clavicle an important bone. Then these are diagrammatic representation. We've talked of the peculiar features. Number one, we have said that it is the only long bone which lies horizontally. So these are a horizontal view of the clavicle. Then it is S-shaped. We have talked of the S-shaped position of the clavicle. Then it has two ossification centers, as we will see later. So this diagram basically just show us the peculiar features. Then it is the first bone to start ossification and the last bone to complete ossification. Then we have parts of the clavicle. So the clavicle has three parts. We have the lateral or the acromial end. Then we have the medial or the sternal end. Then we have the shaft. The shaft is the body. So here is a pictorial view. So here we have the acromial end. Then we have the sternal end. Sternal end is the medial end. Then the acromial end is the lateral end. Then we have the body or the shaft. So this is the posterior margin, this is the anterior margin. This is the superior surface, this is the inferior surface. Then we have the acromial surface, acromial facet, we have the trapezoid line. Then we have the conoid tubercle, then we have the groove for the subclavius muscles. Then we have the sternal articular surface. So this is the surface whereby the clavicle articulates with the sternum. Then we have the impression for the costoclavicular ligaments. Then let's now look at the ends of the clavicle. We have talked of two ends, the acromial and the sternal end. The acromial end is flattened above downwards and articulates with the medial margin of the acromial process. Then the sternal end is enlarged and quadrilateral. It articulates with the clavicular notch of the manubrium sterni. So the sternal end articulates with the manubrium of the sternum. The manubrium is the upper part of the sternum. Then the acromial end articulates with the acromial process. Then the shaft or the body. This is the curved surface. This is where we have the shape S. Then its medial two-thirds is round and convex forwards, and its lateral one-third is flattened and concave forwards. The inferior surface of the shaft possesses a small longitudinal groove in its middle third. So that's the groove that we have seen in the diagram in the past slides. Then the anatomical position and side determination. The side of the clavicle can be determined by holding the bone horizontally in such a way that its flattened end is on the lateral side and its enlarged quadrilateral end is on the medial surface. So this basically helps you in determine the anatomical position and the side of the clavicle. For example, if you are told to sight the bone, that is, you say whether it is the clavicle of the right side or on the left side. So the first thing that you do is that you hold the bone horizontally in such a way. So the main thing is that you hold it horizontally in such a way that it is flat, that its flattened end is on the lateral side. So this flattened end is what we call the acromial end, and then its enlarged quadrilateral end is on the medial side. So this is the side that articulates with the manubrium sterni, the manubrium of the sternum. The convexity of its medial two-thirds and concavity of its lateral one-third face forwards with longitudinal groove in the middle third of the shaft facing inferiorly. So this basically is how you determine the anatomical position and the side of the clavicle. So we have talked of holding the bone horizontally. The flattened end should be on the lateral side, and then the enlarged quadrilateral end should be on the medial side. Then this will tell you whether you have sighted the bone the right way, whether you have correctly positioned it in a manner such that you can know whether it is the right clavicle or the left clavicle. So here is a diagrammatic representation showing the anatomical position of the clavicle. So here is the clavicle. Then here we have the acromion. So here is where we have the acromial head, the acromion end, where the clavicle attaches to the acromion. Then here we have the scapula. Then we have the glenoid cavity. This is whereby the shoulder joint, the part of the humerus, the humeral head attaches to the glenoid head to form the shoulder joint. Then you have the scapula. So let's look at the muscles and ligaments that attach to the clavicle. Number one, we have the pectoralis major. So these under muscles. The pectoralis major is the visible muscle on this, the muscle that is found on the chest, and it is the outer muscle that you can palpate while you touch on the chest. Then you have the sternocleidomastoid. So this is a muscle that runs from the sternum to the mastoid process. So it attaches to the medial end or the sternal end of the clavicle. Then you have the deltoid muscle, then trapezius and the subclavius muscles. Then we also have the ligaments. The ligaments basically help in reinforcing the muscles to provide stability. We have coracoclavicular ligaments, then we have the costoclavicular ligaments and interclavicular ligaments. So let's look at the ossification of the clavicle. The ossification of the clavicle is membranocartilaginous. So it involves the membrane, and that is one of the peculiar features that we mentioned under the clavicle. The whole clavicle ossifies in the membrane except its medial end, which ossifies in the cartilage. So a larger percentage of the clavicle will ossify in the membrane except for the medial end, which ossifies in the cartilage. So this is why we say that the ossification of the clavicle is membranocartilaginous, which means that it involves both the membranes and the cartilage. Then the clavicle begins to ossify before any other bone in the body. So it is the first bone to ossify within the body. As I said earlier, it is the first bone to begin the process of ossification and the last bone to ossify. Then it ossifies by 4 ossification centers. We have the 2 primarily centers for the shaft. The shaft is the body, and then 2 secondary centers, 1 for each end. So let's look at the ossification centers of the clavicle. We are going to look them under the site of appearance, the time of appearance, and then the time of fusion. So the 2 primary centers for the medial and lateral in the shaft. So we are talking about the shaft, not the ends. So the medial and the lateral parts of the shaft, the time of appearance is the 5th and the 6th week in the intrauterine life. Then the time of fusion is the 45th day of the intrauterine life. So this time of appearance is the reason why we say that the clavicle is the first bone to ossify. Then the secondary center at the sternal ends. So the time of appearance is between 19 to 20 years old. However, in females, it occurs earlier by 2 years. So in females, you'll have the time of appearance will be between 17 and 18 years. Between 17 and 18 years. Then the time of fusion will be 25th year. Then the secondary center at the acromial end, which occurs occasionally, the time of appearance is the 20th year. Then it fuses immediately. So as I have said, this time frame, the time of appearance, the 5th week, this explains the reason why the clavicle is the first bone to ossify, and also the last bone to ossify explained by the 25th year, the time of fusion. Then the clinical correlations of clavicle, we have number 1, fractures of the clavicle, number 2, clavicular dysostosis, then cleidocranial dysostosis. So those are the clinical correlations of the clavicle. Thank you for your time.